Delirium. Delirium. We've heard that word before, surely. I mean, for one, there was that groundbreaking YA book called Delirium by Lauren Oliver, about a girl who lives in a dystopian future where love is considered a disease, and where at 18, everyone has to get surgery to remove their ability to love. 13-year-old Sara absolutely ate that up. I have since moved on to more literary works of fiction. And then there was that horror movie about a criminal who hallucinates things while under house arrest in his late father's mansion. The actor from that 70s show was in it, Topher Grace. I haven't personally seen that film, but if you have, I hope you got positively spooked. Even Ellie Goulding has an entire album called Delirium, for God's sake. The thing is, there are all these pop culture references to delirium, but does anyone even know what the word means? Let's hear it from Dr. Eileen Lasharas, an associate professor in the College of Nursing at Sultan Qaboos University in Oman. Dr. Eileen has 18 years of clinical experience and 28 years of teaching experience, so you best believe she knows what she's talking about.
Delirium is a just sudden and severe change in the patient's mental state. It can cause confusion, difficulty focusing, and changes in awareness. People with delirium may seem disoriented or forgetful, and their thoughts might be unclear or jumpy around. This condition can happen quickly, often in response to something like an illness, medication, or a stressful situation. Unlike dementia, delirium is usually temporary and can improve with the right treatment. So sometimes people, they confuse with the dementia, as I mentioned to you. Dementia is a decline in mental abilities that interferes with their daily life, affecting memory, thinking, and behavior. It is usually progressive, worsen over time, with Alzheimer's being the most common type. But unlike delirium, dementia is generally long-term and has no cure, though treatments can manage symptoms.
Imagine waking up one day in the room you grew up in, the room that used to have posters of boy bands you loved when you were a preteen, the room you got your college acceptance letter in, the room you stayed up all night in chatting with your sisters about virtually nothing and everything. Now imagine you don't recognize that room anymore. You wake up feeling foggy and disoriented. The books you have on your nightstand don't ring a bell. You try to sit up, but you feel weak. Nothing in this room triggers a single memory, even though you're straining your mind trying to remember. You attempt to speak, but the words come out jumbled. This is kind of what it feels like to have delirium. In medical terms, the symptoms are as follows.
The delirium symptoms are very clear, very easy to identify. So, as I mentioned to you, it is a sudden change in mental status. The patient will be apparently normal. This may be pertaining to ICU patients or normal population, those who are at home or maybe sick. So, this deliric patients, it will start just like a sudden change in mental status. And generally, there will be a sudden confusion. The person may be having a trouble thinking clearly, or be disoriented about where they are or what time it is. Then attention problems, they might find it hard to focus on tasks or conversations, getting easily distracted. Then they will have a short-term memory, making it difficult to remember even recent events or the conversations. Then another important symptom you may see in these patients are hallucination. It is nothing but some people may see or hear things that are not there, which can be of very distressing exactly. But mood changes, they may experience rapid shift in emotions, feelings, agitated, anxious, or overly calm without a clear reason. They will also have a sleep pattern disturbances, and it may lead to insomnia, that is sleeplessness, or excessive sleepiness. Some of the physical symptoms also we can identify, like sometimes There might be a change in behavior, like being more active or restless, or conversely, becoming very quiet and withdrawn. These symptoms can come on quickly and may fluctuate, getting better or worse throughout the day. So it's more or less very easy to identify as a healthcare professionals.
Delirium can be terrifying for those who are experiencing it and for their loved ones. Although delirium usually occurs in the elderly population, those aged 65 and above, it's actually not unheard of for younger people to experience delirium too.
Nowadays, there is no statistical data available in Oman, but globally, now the trending major problem among youngsters are drug abuse. And some people, those who are stressed overtly, and nowadays we are living in a stressful situation and stressful life because we are running behind the clock. That is not very common among young population, but still they are also vulnerable if they have the risk factors.
You hear that, folks? Take a day off, relax a little, drink some herbal tea before bed, read a book even. Just maybe not Delirium by Lauren Oliver, because stressing yourself out is not worth it. But wait, Dr. Eileen has also uncovered some more truths about delirium. She supervised a research project led by one of her students, Rasha al-Khadar, which found that patients in the ICU have a much higher chance of developing delirium.
Ms. Rasha al-Khadar, a nursing graduate student from the cohort 2019, examined the prevalence of occurrence of delirium among patients in intensive care units in Oman and its various causes and its impact on patients. As I mentioned to you before, delirium is a serious condition. This can happen very often in ICU, which is characterized by sudden change in the mental status, which can manifest as a confusion, difficulty focusing, and alteration in alertness. There are actually two types of delirium: hyperactive, that means patient may be very restless and agitated, and hypoactive, where the patients may appear sleepy or withdrawn. The hypoactive delirium can often go unnoticed by the healthcare providers because the patient will be very quiet and calm, so leading to underdiagnosis and inadequate treatment. So the goal of the study was we want to find out how common delirium in Oman in ICU patients, what are the factors which may lead to delirium, what is the impact of delirium has on ICU patients, including their chances of survival, and how long they stay in the ICU. So what did we do in the study? So we conducted our research at multiple hospitals in Oman, especially within Muscat region, and observed 153 patients admitted in ICU. Bedside nurses assessed these patients twice a daily using a screening tool called the Intensive Care Delirium Screening Checklist to check for signs of delirium. What did we found? The study found that 26.1% of patients experienced delirium. We also discovered that certain conditions and factors were strong indicators of delirium, including infections like sepsis, then metabolic issues like metabolic acidosis, the use of feeding tubes, and the severity of illness. Additionally, we found that the patients with delirium had longer stay in the ICU and had a higher risk of mortality.
Higher risk of mortality. While delirium does indeed have treatment options, delirium patients have a higher chance of developing complications, meaning they have a higher risk of death. In fact, delirium is so serious that it was once used as a weapon of chemical warfare in the Cold War. The tale begins with Colonel James S. Ketchum, a psychiatrist who ended up conducting human experiments at Edgewood Arsenal in Maryland, USA. Colonel Ketchum was a firm believer that chemicals are more humane weapons than bullets or shrapnel. Up until his death, he genuinely believed that his work was done for the greater good. Except he tested various chemicals on healthy people who didn't know what they were experiencing. people who left that facility many years later and developed debilitating side effects that affected them for the rest of their lives. One of these chemicals that Colonel Ketchum tested was BZ. In his own words, this is what the chemical does.
It sends the subject into a state of delirium. It causes the person to jolt from one reality to the next, and the illusions are extremely vivid. The person is in the moment and not even aware that a drug experience is occurring. Animals might appear, disappear. They might see miniature people. They might think that they're smoking a cigarette or eating a ham sandwich when they have a shoe in their hands.
In his quest for a greater good, James Ketchum might have created something arguably worse, because delirium is no joke. It is a disorienting, taxing, and difficult condition to deal with. Some may never regain the mental function they once had. And although we can't change what happened in the past, we can certainly focus on the present and making the recovery process of ICU delirium patients easier. Healthcare providers could do this in a number of ways.
First of all, regular monitoring. As I mentioned to you, there are validated screening tools are available. Tools like a CAM ICU and ICD-SC to identify the delirium early by the healthcare providers. Then optimizing the medication management. We need to review and adjust the medication, focusing on minimizing the sedatives and opioids while considering non-drug alternative for pain and anxiety. We nurses, we prefer to use non-pharmacological methods of reducing the pain. As a healthcare providers, if we implement those things, that will be better than using sedatives and opioids to alleviate pain. Then enhancing a sleep quality, create a restful environment by reducing the noise of the alarms and machines in the ICU and light, which also may disturb the patients. So allowing uninterrupted sleep can help them. Then maintain orientation like utilizing the clocks, calendars, and reminders to help patients stay oriented and involve the family members for the support. And mobility. We need to encourage them, promote early mobilization and physical activity to prevent deconditioning and improving well-being. Then hydration and nutrition. That is another important factor to prevent the cognitive impairment linked to dehydration and malnutrition. Then addressing the sensory impairment, as I mentioned, necessary aids such as glasses or hearing aids to reduce the confusion among patients, those who are coming out of anesthesia. Then limiting the restraints, avoid physical restraints unless necessary. Opting for alternative strategies to manage agitation is important. Then implement a multidisciplinary approach like involving a diverse healthcare team to develop comprehensive care plan addressing the delirium risk factors. Education and training. Our staff needs to be given an ongoing training on delirium recognition and management to emphasize prevention and early intervention. These are some of the things we can keep in mind and we can implement it at our each facility, healthcare facility.
To all the doctors, nurses, and healthcare providers, thank you for looking out for our loved ones and always striving to give us the best possible care. I hope you all learned a thing or two from Dr. Eileen, because I sure did.
Thank you for your interest in our programs and the work we are doing at Sultan Qaboos University College of Nursing, Ms. Sara. We are committed to advancing nursing education and fostering research that directly impacts on patient care. Your support and encouragement mean a great deal to us as we continue to grow and serve our community. Thank you so much for once again.
This was Sara Lawati on 90.4 Oman FM.